This is a really funny comic that I love. Bjorn the unspecific. Nope. I still got a lot of pain in my shoulder blades. Well, let me just keep on stabbing you, right? So this is funny to me because that's how people kind of perceive orthopedic acupuncture. That's how they perceive the label of going local. You got pain here? Stick a needle there. That has nothing to do with what we're talking about. You know, when I talk about local treatment, I talk about the origin of the problem, which may not have anything to do with where your pain is at. Okay? So that is a big stereotype in our profession that I want to just get rid of right now. We're not talking about stabbing people where their pain is. We're talking about finding their problem and coming up with a strategy to address it. So this is from the Ling Shu. 60% results if you're an inferior practitioner. So just out of school, you know nothing at all. You're so green, acupuncture is that good. Keep doing what you learned in school. 60% of your patients are going to get better, no matter what. So you should pat yourself on the back because acupuncture is that good. Now, if we want to take it to the next level and really grind hard for the rest of our lives, studying, you know, every day on vacation, we might approach 90% results. So they knew this way back when. You're not going to help everybody, okay? So when you go back to work and you try to apply this, you might get that 1 out of 10 person that they're not going to get better no matter what. It doesn't mean stop. It's not, you know, don't use what we learned this weekend. It means keep doing it and see what happens over time. Observe the patterns. So this is a great quote from a textbook by Pomerantz. So placebo is about 50% successful. And a lot of the research studies that you see about acupuncture, what's the percent of people that are getting better? About 50%, maybe a little more. So usually the sham group gets about 45 to 50% better, and the acupuncture group gets about 55% better. What does that mean? What does that mean? It means that they never did any assessment. They just stuck needles in random places that had nothing to do with the person's problem. They were doing this kind of acupuncture, 60%. Okay, so that's the difference between a lot of research studies. And I have to educate a lot of people on that because if you look at the fine print in acupuncture research, there is no assessment, ever. That is the biggest problem with acupuncture research, okay? And it's not just acupuncture. It's all modalities. There's no assessment. So how do you know these points or whatever modality you're doing is going to work if you don't even know what the problem is? You're treating something that you don't even know what it is. It's a coin toss. 50% get better.